Ever wondered why our bodies experience chills, fever, and body aches during the cold season? Could it be the flu or something else like RSV? Well, let's dive a bit deeper and unravel these medical mysteries. Firstly, let's talk about the flu, a term we often use when we're feeling under the weather. The flu or influenza is a highly contagious respiratory illness caused by influenza viruses. It's not just a severe cold, as some might think. This illness can range from mild to severe, sometimes even leading to hospitalization or death in extreme cases. Influenza viruses travel through the air in droplets when someone with the infection coughs, sneezes, or talks. You can also get the flu by touching a surface or object that has the flu virus on it and then touching your own mouth, eyes, or nose. Now let's shift our focus to RSV, which stands for Respiratory Syncytial Virus. This is another common respiratory virus, but it usually causes mild cold-like symptoms. Most people recover in a week or two, but RSV can be severe, especially for infants and older adults. RSV is also a contagious virus. It spreads through droplets containing the virus when someone infected coughs or sneezes. You can catch it if you touch your face after touching a contaminated surface or from direct contact, like kissing the face of a child with RSV. While both the flu and RSV can make you feel miserable, it's important to remember they're not the same. Each is caused by a different type of virus, and their symptoms, although similar, have their own unique differences. So the next time you're feeling unwell, don't just brush it off as a simple cold. It could be the flu or RSV, and knowing the difference could be crucial for your recovery and those around you. Knowing the causes of the flu and RSV is the first step towards prevention. But how do we identify these illnesses? Stay tuned as we explore that next. Now that we know what causes the flu and RSV, how can we tell if we or our loved ones are affected? Let's dive into the symptoms. Both the flu and RSV share common symptoms like fever, cough, and fatigue, but there are differences. Flu symptoms tend to be more intense and come on suddenly. You might experience body aches, chills, and severe fatigue. A dry, hacking cough, sore throat, and runny or stuffy nose are also typical. On the other hand, RSV symptoms are usually milder and resemble those of a cold. They include a runny nose, decreased appetite, and a cough that might produce yellow, green, or clear mucus. However, severe cases of both illnesses can lead to serious health complications. In the case of flu, it could be pneumonia, while RSV might lead to bronchiolitis or pneumonia, especially in infants and elderly. Identifying the symptoms early can make a significant difference, but what happens next? So, we've identified the symptoms of the flu and RSV. What are our options for treatment and prevention? For milder cases of flu and RSV, over-the-counter medications can be effective in managing symptoms. These include pain relievers, decongestants, and cough suppressants. Don't forget, it's crucial to stay hydrated and get plenty of rest. In severe cases, hospital care might be necessary. Antiviral medications can be prescribed to lessen the severity and duration of the illness. For RSV specifically, some patients may need oxygen therapy or mechanical ventilation in the most extreme cases. Prevention is always better than cure. Regular hand washing, avoiding close contact with sick individuals, and cleaning surfaces frequently can help prevent the spread of these viruses. Flu vaccination is also recommended annually for everyone above 6 months of age, and high-risk groups may benefit from an RSV immunization. Remember, early detection and proper treatment can help manage the flu and RSV effectively. Stay safe and healthy. This information is an educational aid only. It is not intended as medical advice for individual conditions or treatments. Talk to your doctor, nurse, or pharmacist before following any medical regimen to see if it is safe and effective for you. Want more videos like these? Please like and subscribe.